Hey everybody, in this pre-lab video I'm going to go over manual airway maneuvers. So this is two different ways that we can open the airway of a patient who is severely altered or unresponsive and might have an obstruction in their airway that we need to clear so that they can breathe better. The most common obstruction we get on patients who are severely altered or unresponsive is the tongue. So these are designed to lift the tongue off the back of the throat so that your patient can breathe easier. The first one I'm going to demonstrate for you is called a modified jaw thrust. The modified jaw thrust is used on trauma patients where we don't want to risk moving their head or neck. So to do the modified jaw thrust, you put your hands on their head like so. If you'll notice, my middle fingers are on the angle of his jaw. You can use your middle fingers, your pointer fingers, whichever one is more comfortable. And I'm just going to push his jaw upward. As you can see in the video, his jaw goes up. So this has the effect of pushing the whole jaw and tongue forward, thus lifting it off of the back of the throat without me moving his head or neck around, thus letting us keep C-spine. Alternatively, if we have a medical patient where we're not worried about moving their head or neck, we can do what's called a head tilt chin lift. So on the head tilt chin lift, I take my top hand and put it on their forehead, and I take my bottom hand, 2 fingers, underneath the chin, and I just lift the chin up while tilting the head back. Don't reef it all the way back. We're not trying to cause them a neck injury. We just want to tilt their head back, lift that jaw up, once again lifting that tongue up off the back of the throat, making it easier for them to breathe. This is the first maneuver we do on anyone that we are going to, well, these 2 maneuvers are the first thing we do on anyone who might need airway management. So head tilt chin lift, modified jaw thrust, just depends on if it's a trauma patient or a medical patient.